Assalamu alaikum. So our first lecture for the conference is related to the DAR Global Survey, and I'm going to give an overview of this very important survey. This is a survey monkey that has occurred over 2 years in 2020 and 2022. The total sort of clean data that we have is 15,902, almost 16,000 persons. These were distributed among 5 different regions: Gulf, Maghreb countries, Middle East, Indian subcontinent, and Southeast Asia. And the proportion is, and you can see here, almost 20% for each region. Obviously, number-wise, this is really quite large. This is the largest global survey since PDR, which was roughly about 12,000 persons and conducted in 2001. So we were well overdue for a large survey such as this. And I would like to sincerely thank every single investigator, 75 investigators from 14 different countries in 35 cities. Without their collaboration, they are all independent, they are all volunteers like myself. Nobody was paid anything to do this survey. So thank you all very much. And I look forward for future more collaborations. As you'd see, the actual countries that we covered goes from as far as Morocco, west to Indonesia, east, going across the North Africa, the Middle East region, the Gulf, the Iran, the Indian subcontinent, and then the Far East Asia. Here are the percentage from the different countries, with the highest proportion being from Saudi Arabia, followed by Pakistan, and then Malaysia, and then Algeria. So it's really quite impressive figures from all regions, and again, thank everyone. The mean age of the population of the study in general, for both the overall, for all people of type diabetes, type 1 and type 2, was 50 years of age. Nicely split between men and women. The vast majority, 84%, were people with type 2 diabetes, 15% were people with type 1 diabetes, and about 0.5% with gestational diabetes, which we haven't really looked at for this conference. Now, when you look again to subgroups, I mentioned type 1 diabetes. Now, this is very important because the largest cohort of type 1 diabetes was far much less than this number. So I'm delighted that we have over 2,300 persons with type 1 diabetes. But also the large number of the population allow us to have nearly 1,500 persons with macrovascular disease or nephropathy, and a very interesting set of data for diabetic foot ulcers, thanks to the large contribution from Dr. Sameh from Iraq. So this is really unique data as well. As I mentioned, the information will give us lots of insights, including very important insights into geographical differences between one region and the other. Perhaps it's difficult to dissect it to just the geography, but certainly culture, infrastructure, availability of treatment, many aspects. The data also will give us insights into what happened to a person treated with sulfonylurea, treated with SGLT2 inhibitors, or insulin. Of course, all the other therapies are included, but these are the 3 classes of drugs that in recent years people had questions about how can they best manage their person with diabetes treated with that type of treatment, as well as, of course, the interplay of these types of therapy together. As I mentioned, we also have, from the large 16,000 persons, the opportunity to understand who are the people who did not fast, what is their profile. And we have here 2,686 persons. Equally, those who developed hypoglycemia during Ramadan, 2,800 persons. What are their characteristics? What they did when they have a hypo and so forth. So many of these aspects will be covered in the conference over the next 2 days. I'm going to focus now on the people with type 2 diabetes, give a brief overview of them. The mean age was 55 years of age and nicely split between men and women. The mean duration of diabetes was roughly 10 years, where the 55% of them will be less than 10 years duration. But on the other 45% were over 10 years, either 10 to 19 or over 20. Body mass index, as you expect with type 2 diabetes, was raised in the overweight category of 27.8, and 40% had an HbA1c below 7.5. The rest had a higher HbA1c with an average HbA1c of 8%. Now, being with that age, being with that duration of diabetes, so no surprise to see that roughly about 50% had hypertension. Microvascular complications were primarily the predominant one, with 21% nearly had neuropathy. Macrovascular disease of any type was 12%, and nephropathy was 10%. We also captured data on microalbuminuria, and that was 4.8%. Foot problems with ulcers, ulcers or amputation were the minority of 3.5%. But this also collectively make you think of the total population of type 2 diabetes. Treatment-wise, 43% were on any type of insulin. Sulfonylurea was nearly 39%, and SGLT2 inhibitors were on 19%. The most common, of course, drug used was metformin in 80% of the population, and the third common was DP4 inhibitors of 32%. When I look into the fasting population, and the first question here is how many opted in type 2 diabetes not to fast? And that's nearly 15%, 14.6 to be precise. The vast majority fasted the full 30 days, as you see in green here. 66% fasted the full month of Ramadan in either years of 2020 or 2022, with a mean duration of fasting of 27.6 days. 30% fast Shawwal, and that's an important point to remember that Ramadan is not the only month where Muslims fast. A third, roughly, fast other days in other months of the year. Stopping the fast because of diabetes-related illness, not because of travel, not because of physiological needs or other illnesses, because of diabetes-related illness, occurred in 11.7%. Hypoglycemia occurred in 15.5%, with the majority having the hypoglycemia roughly between 1 to 7 days, that's 86%. Those who had frequent hypoglycemia, i.e. over 8 days up to, and unfortunately we have some people who had hypoglycemia even every single day, and every single day they were attempting to fast, was 14%. This hypoglycemia was severe enough to make 11.7% of those who had hypos, not of the population, of those who had hypos, needing to go to the emergency room or be admitted to hospital. The timing of the hypos, the yellow is the between Asr and Maghrib, 3 p.m. and sunset time, followed by between midday and afternoon, Dhuhr and Asr, and then the split between post-suhoor and mid-morning. Hyperglycemia is another problem that we sometimes forget. And it's clear here that 15% do get hyperglycemia, which in the definition was more than 300 milligrams per DL or 16 millimole per liter. And the average number of days was 6.8 days. The vast majority did not have frequent hyperglycemia, but roughly about 28% had very frequent hyperglycemic episodes. Monitoring in Ramadan is very important as monitoring in other days, and I'm sorry to see that 26% did not monitor at all, and indeed 13% have monitored less frequent than before Ramadan. Now, obviously, we'd think that people would monitor more frequently, but this was only experienced by 13%. Nearly 50% did what they were doing before. The core line in Ramadan is education. 40% did not receive any education. And unfortunately, those who received education was the vast majority of them done by the doctor during the routine clinic room consultation, and that did not last more than 0 to 15 minutes. So kind of a quick advice from the doctor during the consultation. Group sessions or online were done, but that counted for roughly about 15% of the total population of type 2 diabetes. So these figures are important figures that we all need to remember to try to improve. So let me summarize the take-home messages. The DAR Global Survey is the largest independent diabetes and Ramadan survey. It included roughly about 16,000 persons split between 2020 and 2022. It included 14 countries and 34 cities and 75 investigators. The 2020 data we already had 4 publications out of it. The 2022, this is the first time that any data would be shared during the conference. We had a wide variety of information on all aspects of diabetes in Ramadan, including, as I mentioned, diabetic foot, the non-fasting person, hypoglycemia, impact of age and or duration of diabetes, and many other issues that you will see during the conference. For type 2 diabetes, my take-home message is the vast majority are able to fast. But we seem to have a rule of 15. 15% do not fast. 15% roughly develop hypos. 15% roughly develop hyperglycemia. And 15% develop frequent hypoglycemia, which was more than 8 days over the month. 40% were not checking SMVG or checking it less frequent than before Ramadan. And indeed, 40% did not receive any Ramadan-focused education, and most education was conducted briefly by the doctor during routine clinic consultations. So the 15% rule, I put it here again for everyone because it was quite interesting. As you know, 15% or 15 grams is the usual amount to correct hypos, and then 15 minutes to wait and so on. But I really want to finish by thanking again the champions of the survey, who are the investigators from the 14 different countries and 35 different cities. Thank you all, and I hope you enjoy the conference, and I look forward to the question and answers at the end.